Okay, welcome everybody. I'd like to thank you all for joining us again for this week's session of Aging Strong. Before we get started, I would like to let you know of a few upcoming programs that are happening here at the library this week. This is just a friendly reminder that we are holding community yoga that takes place every Wednesday in our community meeting room from 9:30 to 10:30 a.m. If you have a mat, you are encouraged to bring it. If you do not own a yoga mat, there will be some on hand to provide if you need one. Additionally, on Wednesday night at 7 p.m., we are very happy to be joined by the authors of the travel guide, A People's Guide to Greater Boston. They will be giving a lecture series on their book about the history of Boston through various movements, helping to lift marginalized people. So from slavery on. And then lastly, rounding out our programming for this month on the 24th, so that's Thursday night, again at 7 p.m., we're very happy to be presenting a lecture on the signing community on Martha's Vineyard. And that will be again at 7 p.m. And now I'd like to turn our program over to today's speakers. Debbie Lynn Toomey, she is the Injury Prevention Coordinator at Tufts Medical Center. Debbie, thank you so much for joining us today.
Thank you so much, Carrie, and thank you to the Thomas Crane Public Library and QATV for helping me continue to do my outreach work on injury prevention. This program, Aging Strong Fall Prevention, centers around offering educational and empowering content for the older population to help them live strong, happy, and empowered lives. So today is a very special program, and it centers around this particular organ in our body, the brain. So as far as falls goes, the falls happen at any age during our life. And as we get older, the risk for falling increases. And that could be from medical reasons, medications, disabilities. There's a whole slew of factors that can lead to falling. And sometimes the injuries themselves can lead to damaging and also maybe deadly consequences. So one of the common injuries that happens from unintentional falls are brain injuries. And so today we have Justine Cody from the Brain Injury Association of Massachusetts. She is the education and program manager there, and she'll talk about brain injury, different types of services and resources that's available for the survivors, the families, and friends of people who suffered brain injury. So Justine, welcome.
Thank you, Debbie, and thank you everyone here joining us. Again, my name is Justine Cody, the Education and Program Manager at the Brain Injury Association of Massachusetts. I'm here really hopefully to give insight on what we do as an organization. The Brain Injury Association of Massachusetts has been around for quite some time, and we have really, really great resources and support and programs and events that we offer the community. We are a nonprofit, and we really try to get the message out there about how important it is to protect our brains. And we have a lot, and I know that I have a lot to share today on how you may be able to utilize some of our services if in fact you do identify yourself as a brain injury survivor, and or you have family members, or you just want to know a little bit more about our organization as a whole. I will also bring to this group today a little bit of brain injury information, sort of brain injury 101, to sort of give you some insight on what a brain injury is, how often it may happen, those types of things. And I think one of the most important pieces is the prevention piece, right? It's really looking to how we prevent brain injuries, TBIs in particular. And we'll talk and take a bit deeper dive into talking a bit more about how falls can be prevented. Obviously, not all falls can be prevented, but there are ways in which we can eliminate some of the risky factors and things that may be in your life to eliminate falls and those types of things, as falls is the #1 way someone sustains a TBI in the US. So a little bit just quickly about myself. I've worked for the Brain Injury Association of Massachusetts for about 8 years now. I have a passion for teaching. I was a teacher before I came to this agency. I have a passion for prevention, but also I come here as a as a caregiver. I had someone in my family that had a brain injury, and it was really hard to get through. And I really wanted to be able to have an opportunity to give back. And we were given so many great resources and support through Massachusetts in general. I wanted to be able to have a platform to give back to this community and also learn more myself as I grew in my career. So a little bit more about the Brain Injury Association in Massachusetts. Our story is from a grassroots effort. A small group of family members came together back in 1981 to address the need for brain injury services here in Massachusetts. These efforts created the Brain Injury Association of Massachusetts. The Brain Injury Association of Massachusetts was incorporated in 1982 as one of the first statewide brain injury associations in the US. So what's really unique about the Brain Injury Association of Massachusetts is, for one, if anybody out there is parents or, passionate about family, right, you go to the ends of the earth for your family. And that's what it was really for mothers that sat around a kitchen table that said, I need more services for my children. And then it started here in Mass. And now basically every state has their own Brain Injury Association in Massachusetts. And nationally, there's the Brain Injury Association of America in DC. So our mission continues. The Brain Injury Association of Massachusetts, or known as BIAMA as an acronym, it's a private nonprofit organization that creates a better future for all those affected by brain injury. The purpose of the organization is to educate the public on the risk and impact of brain injury, promote programs to prevent those injuries, and advocate for improved legislation. And this is all to offer support and resources to persons with brain injuries and their family. So just to dive in a little bit here on what we do as an organization. So maybe you're able to utilize some of these support systems we have in place, such as our public policy, our prevention, our support and resources department, where we're always ready and able to take phone calls, email us. I'm going to put a lot of information in the chat after on how to be able to contact us. But in addition to that, our education and programming. I'm going to go into those a bit more in just a little while, but know that, we do have those 4 pillars, and we really make an effort to make sure that we're getting information out to the public in those 4 ways. We are dedicated to change. In the last 4 decades, BIAMA has played an instrumental role in advocating for funding for individuals with brain injury. Certainly at the state level, we're helping shape services on a national level. So to dive into that public policy, sort of our first pillar there, we had involvement in establishment of the statewide head injury program, SHIP, while within the Massachusetts Rehabilitation Commission in 1985. We established the trust fund, the Head Injury Treatment Services HITS Fund, which funds state services for people with traumatic brain injuries. We were instrumental in the passage of the seatbelt law in 1986, and then the passage of the secondary seatbelt law in 1993. And then the Hutchison versus Patrick federal class action lawsuit on behalf of individuals with acquired brain injury in 2008. And then more recent and current initiatives will be, I think, helpful here to know, especially, what we're dealing with right now in our current climate with the pandemic, but even before then, in the latest 3 legislative sessions, an additional upwards of almost 5 million increase for SHIP. But in January 2021, we have a healthcare bill that was passed requiring commercial health insurance plans and the Group Insurance Commission and the Mass Health to cover cognitive rehab or cognitive rehabilitation for COVID-19 patients. And because we're seeing that people, of course, after testing positive for COVID-19, having residual, medical complications, but we are seeing that there are neurological complications people are facing after COVID-19. Additionally, our cognitive rehab bill, our cognitive rehabilitation bill will require commercial health insurance plans to cover cognitive rehabilitation after ABI. So I wanted to take a pause there, as that was sort of a lot of public policy thrown your way. And I just was curious, while this isn't my particular department, I know about it from working in collaboration with this team. I'd be happy to give the information that I know if you do have questions on this. And if I cannot give you the information you may need if it's in-depth question, I can get you the public policy manager, Kelly Budaleri at our organization, that would be sure to help you with anything there. I wanted to put it to the group. Any questions here with public policy?
Justine, I do have just a couple of comments and questions. When you mentioned earlier TBI, you did explain what that was, the traumatic brain injury. In the medical field, we tend to do a lot of acronyms. So the TBI, and I'm sure you'll be talking more about that later on, because as a nurse who by trade and work in the trauma department, that is one of our common diagnoses that we see patients coming in with unintentional injuries from falls, is a TBI, traumatic brain injury. I really love the heading that you had there, dedicated to changes, because so many people out there, maybe including me sometimes, we don't like changes. We like the routine. So to see that the Brain Injury Association of Massachusetts are dedicated to changes, and really from the slides that you are showing us, the different types of policy changes and fundraising and what's available out there, really current ones for even for the COVID-19 patients with cognitive disabilities, just from having that long COVID type symptoms, right? Having difficulty with what, like thinking or memory or speaking? Is that pretty much?
Yes, and no, it's that what we're seeing a bit is that brain fog, sort of not feeling yourself, those long haulers, so to speak, that they're just not getting better, and cognitively something's a bit off and different. This is obviously, as you know, as a clinician, that this is new information. We're just exploring it. The information is coming out there, but we're seeing so many more people, especially coming to BIA and saying, you know, cognitively, I just don't feel organized after. I'm having some memory deficits, in sort of connecting that to being diagnosed with COVID-19. And the other thing I think is important from our level, especially when we, I'll discuss at the end sort of our upcoming offerings, so to speak. But one of them is getting information out there to clinicians in a training webinar conference type situation, where we're getting out the information about COVID-19 and the neurological effects, because it's really important that our clinicians that are treating patients are understanding this, that, you know, it isn't just looking to see if they had some type of head injury. In addition, oh, was this person recently diagnosed with COVID-19? Is this a contributing factor? Things like that. So it's very important to consider and get out the information to the public, to these practicing clinicians who are treating patients.
Yeah, very good point, because sometimes, you know, as clinicians, we like to treat, we like to see the people get better. And then, you know, okay, we'll see you in the follow-up appointment, or if anything gets worse, let us know. But it's really important for us to keep that in the forefront of our brain, to really consider, okay, the patient that is in front of me had COVID-19, they recovered, but is this, you know, are they presenting at their baseline level? Are they, do they have that brain fog? And then that's something maybe to ask the family member who accompanies that particular patient. Hopefully there is a family or a friend who is there and can let us know, okay, is this their baseline, or is this something that is new since COVID? So thank you so much for bringing that up. So if anybody has any questions, please type it in the chat or unmute yourself. But if not, I'm sure there's going to be lots of opportunities for questions.
Absolutely. And just finishing up here with public policy, I just wanted to make mention that we have the Head Injury Treatment Services Trust Fund bill, and that will increase funding by increasing fines under the trust fund. In addition, we have the Acquired Brain Injury Advisory Board bill that will establish a permanent legislative advisory board on ABI, and will continue to work. That will continue the work of the 2019 ABI Commission. So with that, I think it's important to talk about one of our next pillars, and this is a piece that I'm pretty passionate about is this is what I do best, as the prevention piece. I came into BIA as a prevention coordinator and sort of moved up into the educational program world. But basically, BIA offers several programs that educate the community on brain injury prevention. One of those is our Think Ahead program. It's our program that goes into the schools. It's a free program that can go to any school. Right now it's virtual, like all of our programming, but it is a great opportunity for a health class, or really any teacher that usually RNs will call me up. The school nurse will call our agency up and ask for this program. So we make sure we get information out to the youngsters on how important it is to keep their brain safe. We're talking about seatbelt use, playground safety, helmet use, where to sit safely in a vehicle for the youngsters. But as we move into middle school and high school, we're talking about why it's important that you never get into a vehicle if someone's under the influence, why wearing your seatbelt is so imperative, texting and driving, and why putting driving first is absolutely necessary when learning how to drive. And we go into a lot of driving schools with this particular program as well. Our Brains at Risk program is a prevention and awareness program put on by BIA for years and years now. It's a very successful program where basically anyone can come to our Brains at Risk program. I think personally that anybody can use the information that we present at our Brains at Risk program. Basically, we're linking the risky driving behaviors like texting and driving, like driving under the influence, like driving without a seatbelt on, connecting that to the devastating effects of traumatic brain injury. But a lot of the people that come to our Brains at Risk program are referred from a court situation. So they have at some point in their recent past been referred from a court saying, we want you to take this program, learn a little bit more about brain injury and how risky it can be on the roadway in general, never mind these additional factors, being under their influence, not putting driving first and texting and those types of things. So people walk away from our Brains at Risk program really inspired, because we also have survivors or people affected by brain injury come on to these presentations to speak about what they've been through. And it really does put a face to brain injury, and it really does certainly bring that aspect of the human spirit to what people have been through, to sort of tell that cautionary tale. So people hopefully take something away, and we do start to see decreasing, injuries on the roadway. And then lastly is our Survivor's Voice program. This is a wonderful program we do every other week in Tewksbury at a second OUI DUI offender program that basically is similar to Brains at Risk, that we're really bringing to the forefront on how important it is to put driving first, but we really get that survivor's voice out there, and we have that survivor speak for a longer amount of time to really get out to this particular group how important it is to be a sober driver. So those are our prevention programs, and I'm more than happy outside of this presentation to give any more insight, or if you're curious about Think Ahead for your school or someone that school, I'm happy to be able to give that information to anyone and how you sign up for any of those classes. What's really important about our agency is that, again, a lot of the things that we have in terms of support and resources are a free resource to you. Basically, we want to promote the general welfare, rights, and dignity of persons with brain injury, promote and foster the empowerment of persons with brain injury, assist survivors and families to obtain appropriate services and support, and then we provide information and resources for persons with brain injury, their families, friends, and professionals. One thing that I know is really impactful and really helpful for individuals that identify themselves as a brain injury survivor and or a caregiver, a family member, support groups are critical. You want to be around people that have possible like situations, or you can bounce ideas off of, or be in a group that you can identify with. And that's what we can provide. We have several support groups right now. They are virtual. As I mentioned, all our programming is virtual. The link is below to be able to find a support group that may be best fitting for you. We have several, and not every group may be for you, but I'd encourage anyone here that's interested to join a group to see what it's about, if it's applicable to you. Basically, it's really a great place and a nice forum to share information, be able to have that opportunity to socialize and make make new friends with others, because after brain injury, it can be very isolating. You can feel isolated and alone. And the BIAMA wants everyone here to know that you're not alone in brain injury, and we're here to help. Before we moved on to any educational services, I just wanted to put out if there was any questions on that piece, to be able to give you any information, resource and support wise that you may want.
If anybody has any questions, please type them in the chat or unmute yourself. But I'm glad to hear that the education or the programs that you have right now are very accessible. Especially, now with COVID, there's a lot of different programs that's in the internet and virtual. So I'm not sure if I missed it. Are there any costs to any of the programs? And what is the best way for people to know any upcoming programs that may be relevant to them or interesting to them?
Absolutely. So in general, our programs in terms of support and resources, there's no cost associated with many of those. We do have rec events where it may, we have a paint and sip, or, certain events that may have a small denomination, which would actually only be covering the package that would be sent to your home, like the paint or what have you. But a lot of our support groups are free of charge. Those types of things you're able to attend free. Some of our a lot of our programs in terms of educational needs, I'll go into a little bit of our education needs in just a moment. Those have denominations connected to them if you're a professional, because they're connected with CE credit. But overall, a lot of our services are free of charge. And I wanted to also mention, Debbie, that you don't need to provide us with any sort of insurance information, or even that, any medical documentation saying that you are identified as a brain injury survivor. You just need to call. We don't look for any of that type of information, and that might be helpful to this group to know as well.
Wow, that's great. Very generous. Thank you.
So our educational program offerings, we have several. First is our annual brain injury conference, which is coming up in March. March is Brain Injury Awareness Month, if you weren't aware of that. We have our conference at the end of each month of March. This year it's the 30th and the 31st. It's a 2-day event. Wonderful, wonderful conference. In person, we see upwards of 900 plus people. Virtually, it's close to that, which is wonderful because it really does like you mentioned, it broadens who we can reach. And we'll see many different people from even different states joining us. Our keynote speaker is Molly Parker, who is widely known for Concussion Compass. So this year we have a really great lineup, but again, it is virtual this year, but it's a wonderful conference where professionals, survivors, family members, caregivers all can come together and really take away from our programming, because it's not just set for professionals, or it's not just set for survivors. It's a really unique sort of mix of educational offerings throughout the day. So this you can find at our website, biama.org, and navigate the top bar that has basically our education department, our prevention department, our advocacy department, and you can navigate from there. But under the education tab is where you could register for our annual brain injury conference. Family and survivor education. This is a wonderful offering, free of charge virtually right now, where you could come to what we have called currently right now the Thrivers program, where it's giving you tips and tricks and organizational, you might need some help with organization in your life. So we have a Thrivers presentation that sort of accompanies that and really helps you with those pieces of your life. So we have these really great helpful hints for survivor and family education that you can sign on and learn more about that. Our introductory acquired brain injury series is a wonderful set of series and programming where it really talks to our frontline workers, people that are in our brain injury group homes and people working with brain injury on a daily basis, so that you have some insight on what a brain injury is and how you might want to work with individuals with brain injuries, because they are unique. Brain injuries are very unique. They're not like other injuries. So they really come with, some really different set of skill set and knowledge. Acquired brain injury clinical continuing education series was the series I was talking about a little bit before, where it's connected to continuing education credits, where if you are a PT, an OT, an RN, LPN, a psychologist, you are able to come to these series, not only get knowledge and be able to continue that into your practice, but also be able to obtain CE credits, of which people need to continue with their licensure. But at this point, I want to be able to dive right in, as you know, we only have a certain amount of time today, but I do want to get into sort of the scope of acquired brain injury and sort of what a brain injury is. So what is an acquired brain injury? So we have been throwing around that term TBI, traumatic brain injury, but really let's look at it from, you know, a broader scope. Acquired brain injury. That's that umbrella term. Almost look at it. It's all brain injury. It's a range of disorders and diseases affecting the brain. Onset is after birth. It's not hereditary or congenital, and it's beginning in that newborn period throughout the lifespan. And a majority who experience an ABI are adults. Who is affected? ABIs are experienced by both males and females. Thousands experience ABI annually in all regions of Massachusetts. Most individuals survive their injuries. Causes of acquired brain injury, it's interesting to sort of get into what these are. We could spend a lot more time on sort of the causes, but this is sort of, again, a broader look at how someone sustains an ABI. First is infectious disease. So this is associated with disorders of the brain, maybe meningitis, encephalitis caused by bacteria, viruses, parasites, or other infectious agents. Metabolic disorders, which may be related to systematic disease, such as liver disease or other conditions affecting the brain, anoxia, right, that lack of oxygen to the brain. Neurotoxic disorders, including brain injuries resulting from environmental or occupational exposures to toxins, such as metals, so like lead poisoning, gases, carbon monoxide, as well as overuse of drugs and alcohol. Causes of acquired brain injury would be neoplasm. So we're looking at brain tumors. So, you know, this is sort of, it could be primary arising in the brain, within the brain, or it can be secondary, right? Representing mass, you know, it could spread from a cancer from another site, right? So you could have it in the brain, or it can spread from somewhere else. Neurovascular diseases and conditions, including stroke. Stroke is the second leading cause of ABI. And then trauma. So that's the traumatic brain injury, that TBI acronym. And it's externally caused brain injury, which is the leading cause of ABI. Okay. Before we get in here, any questions there from anyone in the group?
No. Great information. Thank you.
Absolutely. So let's look at that TBI. That's sort of what we're talking about a little bit today, in terms of us moving into our next segment in just a moment, talking about falls. But the leading cause is falls, leading cause of traumatic brain injury. But other ways are firearms, motor vehicle crashes, strikes by an object or a person, explosions, right? IEDs, improvised explosive devices. We had a lot of people come to us at BIA after the Boston bombings that not only could they have had shrapnel go into their brain, but the sheer magnitude of the blast actually could cause a TBI. Our military coming home that are affected by traumatic brain injury, not only are they coming home with physical injuries and PTSD and those types of things, we're identifying in our military population and hopefully trying to give them more services as they come home, and maybe also facing traumatic brain injury. And then context would be sports, recreation, occupational activities of daily living, interpersonal violence, domestic violence, military combat, child abuse, unfortunately, safe shaken baby syndrome, homicide, and suicide attempts. Okay, so I think at this time it'd be behoove us to sort of go into in depth a little bit, falls and falls prevention. This information is straight from the CDC. They give the most up-to-date information on falls and statistics, but falls are the most common cause of TBI in the US. 1 out of 5 falls cause a serious injury such as a broken bone or a head injury. Each year, 3 million are treated in emergency departments for fall injuries. In 2015, the total medical costs for falls totaled more than $50 billion. Medicare and Medicaid shouldered about 75% of those costs. Okay, so, many falls do not cause injuries, but we just saw 1 in 5 falls does cause a serious injury, such as a broken bone or a head injury. These injuries can make it hard for a person to get around, do everyday activities, or live on their own. Right, so falls can cause broken bones, wrist or an arm or an ankle or a hip fracture. Falls we know can cause head injuries. But something to think about is, fear of falling again. So it's a situation where, people can be afraid of falling. This fear may cause a person to cut down on their everyday activities. So when a person is less active, they become weaker, and this may increase their chances of falling. So this sort of slides right into thinking, who is at risk here? Who's at risk for falls? Research has identified many conditions that contribute to falling. These are called risk factors. Many risk factors can be changed or modified to help prevent falls. So you want to look at, lower body weakness. Is someone that may be at risk? Could they have lower body weakness or a vitamin D deficiency? Difficulties with walking and balance, use of medicines such as sedatives or antidepressants, even some other over-the-counter medicines can affect balance and how steady you are on your feet. Think about vision problems, foot pain or poor footwear, home hazards or dangers such as broken or uneven steps, throw rugs or clutter that can be tripped over. Most falls are caused by a combination of risk factors. The more risk factors a person has, the greater their chance of falling. But falls can be prevented, and there are simple ways in which we can sort of keep an eye out in terms of keeping, an eye out for those situations where we talked about just a moment ago. What you have on your floor, or have you had your eyes checked, those types of things. So, you want to talk to your doctor, your healthcare provider, to evaluate your risk and talk with them about specific things that you can do. So ask your doctor or pharmacist to receive your medicines to see if any might make you dizzy or sleepy. This should include prescription medicines and even over-the-counter medicines. Ask your doctor or healthcare provider about taking vitamin D supplements to see if that is right for you. How about exercises? Do those strength and balance exercises to make your legs stronger and improve your balance. Some examples might be great if you have an opportunity to take Tai Chi. Tai Chi is a great example, or a great way to get those exercises. It's, you don't need a lot of endurance for that, but it can be very helpful, we found. And also even, taking a walk outside, a brief walk. But that leads into having your eyes checked. My mother is getting to a point where she has to her prescription glasses aren't great for her when she's outside and she's walking. She notices she has to sort of take prescription glasses in her that she has the bifocal. So it's hard when she's looking down, she trips on the sidewalks. And she's noticed she has to change her eyewear when she's out taking a walk. So having your eyes checked and sort of asking about these bifocal or progressive lenses and how that might affect you while you're walking might definitely worth asking when you are visiting the eye doctor and the optometrist. And then, make your home safer. There's so many things that you can do at home to make your home a bit safer. You want to get things out of the way that you could trip over. Add grab bars inside and outside your tub or shower and next to your toilet. Put railings on both sides of your stairs. Possibly make sure your home has lots of light and adding more brighter light bulbs. Keep items you use often in cabinets you can reach easily without having to use a step stool. And use non-slip mats in the bathtub and on the shower and on shower floors. So these are just, sort of tips and tricks that we have to be able to help you identify what might help in your home to make it a bit safer and hopefully do prevent some of these falls in your home. Any questions on that before we move on? Okay, so I did mention our military. I did think it was important, especially here with any veterans that we might be listening in that or know that we have this offering, and we work with you know, a lot of collaborations with our veterans population. You know, sometimes the real battle starts when veterans come home, and we're here to help. And the veterans' worst wounds may be the ones you can't see, right? So that's brain injury. You can't always the injury on your brain. Obviously, it's a silent. We also often call it a silent epidemic. Like people are coming home from our military and fighting overseas, and they need the help. And are they going to get the help they need? We are now coordinating a veterans support group that will be up and running in the springtime. So if that interests you, please keep an eye out on our website, biama.org/support groups, to be able to see when that's up and running. So just some insight for veterans there. So I think as we sort of sum up some of our information today, it's important to know factors affecting outcome and recovery of brain injury. Age at the time of onset or occurrence of ABI is important to keep in mind. Sites of the injury within the brain and severity of neurological insult, and then specific disease or disorder. Nature of the complications that are happening. You want to think about premorbid conditions, any psychiatric disorders going on previous to the injury. Timeliness, accuracy, and access to diagnostic and treatment services. So really getting, if you know, I think back to when we talk to our youngsters, even about you know, concussions, or if you had a concussion, if you've fallen and hit in your head, you really want to get that taken, you know, you really want to get that checked out right away. You know, bump on the head may not just be a bump on the head, basically. And I go to that, you know, when you're just not feeling right, there's just something not right after hitting your head is when you really want to get some help. And then lastly, healthcare disparities that might, again, be factors in affecting outcome and recovery of ABI. Other post-injury risks, such as factors like substance use disorder, support of family and significant others. If you have a great support system, outcomes could be a little bit different. When people don't have that support system, it can be difficult after sustaining an ABI. And then participation in rehab. As we know, rehabilitation is so critical after one has any injury, right? But certainly of the brain, cognitive rehab, PT, OT, it's critical to be getting those rehabilitation services. And again, I think it sort of rounds out how BIA is such a big advocate in sort of, you know, part of getting someone better after brain injury, because, you know, not every commercial insurance has cognitive rehabilitation, you know, included in their insurance. So, you know, we're fighting so that people that are sustaining ABIs are able to get the rehabilitation that they need to get back to work, to get back to life, because there is life after brain injury. And while it can seem bleak, and we hate to talk about it like that all the time, but, you know, we want to prevent these injuries, but there is life after brain injury, and we are here to help and support people that do sustain those. So think about functional domains affected by ABI. So motor skills and sensory functioning, you know, blindness, cognitive functioning after ABI, memory impairment, communication and language, right? Someone that could have aphasia after brain injury, and, you know, getting, again, the speech language pathologist, getting that person on your team to be able to make sure you're getting the rehabilitation one needs after ABI. And then think about changes in psychological and social functions related to ABI. So there could be depression, it's the most common mood disorder after sustaining an ABI, personality changes, social and isolation, withdrawal, post-traumatic stress disorder, and anxiety. These are things we see often after ABI that can be treated, with, many of the resources and support that we can provide in terms of getting you to the right clinician or the right support system. Other disorders in persons with ABI, chronic headache and other pain disorders, seizure disorders, sleep disorders, and then endocrine disorders, so that hormone disorder deficiency. In sort of concluding here, again, we at the Brain Injury Association in Massachusetts really want you to know that our purpose is to provide support to brain injury survivors and their families, offer programs to prevent those brain injuries, and educate the public on impact of brain injury and advocate for community service. We are here as a free resource to you. Feel free to call us at the number below or visit our website, biama.org. I'm also going to put a couple things in the chat, if that's okay, in terms of even emailing us. I know people are using email lately to get in touch. Certainly pick up the phone if that's what you prefer, but you can email info@biama.org. That's INFO @biama.org. I want to thank you for having me here today, and I'm happy to answer any other questions or have an open dialogue on anything that we talked about today.
Justine, that was a great presentation. Thank you so much. And I love how you tied in fall prevention in the presentation. So I remember when I was a student nurse, and one of my clinicals, I got to observe in the operating room, these surgeons, the brain surgeons, taking a biopsy of somebody's brain. And that was just so memorable for me, because it made me realize how the brain itself is here, and then there are protective factors, but then there is a skull. The skull is very thick. And I remember how they had to use special machineries to get through the skull, the thick skull, and get a piece of the brain. And so as we get older, what happens to our brain? Does it remain the same size, or does it get a little smaller? What happens to a person's brain when people get older, and why are people who are older, do you think, are more likely to may suffer from acquired brain injury as opposed to somebody much, much younger?
Great question, Debbie. So basically, the aging process does, when you look at the sort of the cerebellum in the back of your brain here, that's certainly when you're toddlers, right? When you're toddling around, we worry about that population as that cerebellum hasn't fully developed, or is going to develop with time and practice. And right, you're not toddling around anymore around 5 or 6. You're running full force, right? So then you sort of go through the progression of life, and then sort of the aging process. We worry about cerebellum that's affected, just pure aging process. So that's sort of what we're looking at in the aging population. I don't know as much about if the brain actually gets smaller, to be quite honest, but I do know in terms of the cerebellum and the aging process, what that means. It means that when the aging process takes place, you can have, those weaker, situations happening in your arms or legs where you're possibly not, as active, and you are prone to falls. But I think I really like that part in the CDC mentions I think it has to do with how you think of falls. And, if you fall once, and sort of having that mindset to not fall again, and that fear, and then not to keep active, right? When we don't use it, we lose it type of thing. So you want to make sure you keep active, but in a way that's right for you, if you are part of the aging population. But certainly as people age, there is connections to how that's going to affect who you are, and if falls are, more prominent for that age group.
Yeah, it's very interesting as well. The impact of trauma or injury to the head. I like to use my brain. When say there is a head hits something, an object. So with the head hitting an object, there is this force. And then what happens inside the head that we don't really realize is the brain gets still continues to move just to try to adjust from that force pressure. And do you think that's part of some of the causes from the acquired brain injury, just from the brain just being jarred inside the skull?
Debbie, you're absolutely right. So like on the outside of our skull, obviously it's quite smooth, but on the inside it's actually rocky and rigid on the inside of the skull. And there's only about a 2-inch area of cerebral fluid in there to really act as protection in a sense. But when that head is moving at intense speeds in a car crash or an intense fall or an intense hit and like sports related injuries, it's moving up against those rocky, rigid areas, causing that bumping and bruising inside the brain, in addition to the initial impact, of which also the initial impact, like you're saying, it's going to hit to one side and momentum is going to bring it to the other side. So you often have this sort of lateral damage, that coup contra coup injury, where they're seeing injury on either side of, where the injury is happening on the brain.
Yeah, it's very fascinating. Since the pandemic, how have you noticed in the BIA, has there been an increase of people suffering from acquired brain injury? If so, what do you think are the causes?
Yeah, I don't know if I can 100% say during COVID there's an increase. What I can say is we've actually, at our agency in particular, we have reached more individuals and we have had more people calling in than typical. But I think that may be because we're home, and I think we've become better in terms of utilizing these virtual outlets like here, and getting on the computer and getting on the phone and making phone calls. Maybe it has to do with not always being on the go where we were always going before, and we had that time to sit and sort of maybe make those connections with agencies that we didn't know about before. We've really tried to broaden our communication out there to the public with a lot of the presentations that we did and we have done during COVID. And I want to make mention and make a side note here. We have this wonderful presentation called The Journey, and it's every Monday at 11 o'clock in the morning. Outside of like a holiday on a Monday, but we have it basically every Monday, and it's really it's a presentation of someone with lived experience with brain injury, survivors of brain injury, that come on and talk about their life and their healing process through brain injury, and how that life after brain injury thought process, and how we got there, and what that means for that individual. And people just absolutely love it. And I bring that up because I think a lot of people connected with us with that presentation, and they really came in and understood what we were trying to get across as an agency. And then additionally, we're seeing those new people come to us saying, I never knew about you before, but we saw The Journey and we loved it. And now they're calling and they're doing support groups and they're doing things with us that they weren't doing previous to COVID-19. So it really, that opened the door, I think, for a lot of people coming in, viewing us every Monday, and knowing it was a safe, supportive network of people that care, and that want to be able to be out there to help the brain injury community. So I think COVID has brought some silver lining to some situations in that respect, but we have seen more people calling us. For what that reason is, I don't have the data to fully support it, but I think my theory is probably up there, and why, just because people need that outlet. They, talk about isolation, and in addition to already being isolated after head injury and feeling a bit different. So,
yeah. Well, we have somebody who wants to ask a question. Daniel?
Yes, I have a couple of thoughts. Excellent presentation, by the way.
Oh, thank you, Daniel.
What is the most prevalent way individuals injure themselves, and how can we prevent that? How can I, as an individual, aside from hibernating, prevent myself from getting injured? And could you tell me a little bit about the conference further?
Absolutely. So Daniel, I think it does go, knowing that falls is the number one way someone sustains a TBI. we went over in the presentation, I don't have to go back over those, but I think that that's really what you want to be thinking about when you're out and about. All seasons, right? But how about the winter time? It's icy. Black ice. I heard black ice out there today. To me, yesterday I was out with a t-shirt on, but today there's black ice. So, being always cognizant that, your surroundings and those type of things so that you can, be prepared. We can't go around with bubble wrap on us all the time, but we do.
That's what I mean, like hibernating.
Right. We have to maybe just taking that extra moment before we leave to be prepared. Do I have the right footwear on? Not always rushing around and making, being a bit mindful. Mindfulness really does come into a lot that your daily life, and so that we're not rushing around and sort of, running and falling, or, not seeing the curb that's near you that you trip over, or whatever it may be. But there's so many ways, Daniel, in which we could prevent, certainly falls. We can try to eliminate a lot of those, but I'm huge on, prevention measures in the car, and putting driving first and putting our phone down. It's so hard to do that. I understand we're so connected to these darn things. My kid's toy was vibrating the other day in the toy box. I'm like, where's my phone? Like, I have to know where it is. We have
the conference.
Yes. So anyway, so for the conference is the end of the month. Our registration is open right now on our website, where you could register, see our particular workshops, pick which workshops you would like, pay for the conference, and then you would be registered. And when it came time, it's a virtual platform. You would basically sign on those 2 days, or you can purchase just the first day or the second day, or both. And you can come on and basically pick whatever workshops you pick. You will join that day and basically join those workshops to get the information that you so desire that's happening during those 2 days.
Thank you.
Absolutely.
Wow. Thank you so much, Daniel. Anybody have any questions? Justine, can you share with us a typical case study of somebody who during the winter time may have a fall and acquired brain injury? And maybe sharing with us what they should do.
Okay. So basically, so if you're saying someone in the winter months, they fall, they take a big fall, they, first off, it's like, what body parts have I injured? What do I got to go see the doctor for? But, really thinking about how did you hit your head? And I also like to mention, I think it's good that you're bringing this up, that it may not be in the moment that your head is hurting, or, it could happen days later that you're feeling headaches and forgetfulness and feeling that brain fog, just not right. And keep that in mind, that it may not happen immediately. And I think once someone does have a fall like that, to be able to get the medical help they need right away. Don't take it lightly, in a sense. I think always advocating for your body and what's happened to you is important. And then once you're getting the medical help with a physician, and they're sort of keeping an eye on you in that way, is sort of being an advocate for yourself. And so once you've seen the doctor, is making sure that you are taking the time you need to rest. Even, technology, maybe being on the computer as long as you are for work is not the best for you for those recovering days. Usually, depending on the severity of the injury, after a couple, depending again on the severity of the injury, a couple weeks, you might be feeling better, but take it easy. And then, making sure that you reach out to us if you have any questions whatsoever. We can guide you in a way to get you the right help that you may need. Again, it may be, you might have post-concussive symptom or syndrome where you're having that injury is going far past the maybe 2 or 3 weeks you were told at the doctor you would feel better in. There really isn't a doctor that's going to tell you exactly when you're going to feel better. So just keeping that in mind and really advocating for your own health and communicating with your healthcare providers. And if you need extra help, we're here to help. I hope that sort of answers your question there, the full gamut of how you want to keep advocating for yourself. And I think the bottom line is when you just don't feel right and things aren't getting better is to get the help and advocate for yourself, because there are physicians out there, there are clinicians that say or may not acknowledge the fact that you're still not feeling right, and they're thinking you should, but it's all about what you feel and you communicating that to those physicians and those clinicians.
Yeah, definitely. And I also want to add, if people should happen to experience a fall of any sort, and in this particular program, we're talking about injury, brain injury, if you're on any blood thinners, very, very important to, even though it may not seem like you have a headache or there's no bumps or bruises apparent, very important that you call your primary care physician, or if you have a nurse practitioner who is caring for you, let them know that you fell or had an injury to your head, and just, keep that at the top of mind, that if you are on any type of blood thinners, because you might, from that impact, sustain some sort of a slow bleed in your brain that may not be apparent on day 1, day 2, but maybe day 3, day 4. So definitely make sure you let somebody know. As far as somebody who has fallen and they want to be proactive, and they want to reach out to BIA. It looks like you gave us a link here. Best way to contact somebody for assistance. Is there any type of case management, or who is the best contact person to get resources and maybe extra help?
Absolutely. So I want to clarify, we don't do actual case management at BIA, but we can get you to the right help. And that's a perfect segue to info@biama.org is a great resource in terms of emailing us at info@biama.org. So you can actually talk to someone. You can reach out via email and say, I need help, or you can call us. And I'm going to put that number in here too, 508-475-0032 is the number that you can call and get someone from our information and resource department to be able to talk with and get you to, whatever your specific need is. We can try to navigate that and try to get the help and resources that we have as professionals and that we've connected with certain, clinicians in the state to be able to provide you with information. We don't give you specific doctors like, oh, you should go to this doctor or this doctor. We give you facilities and what's close to you, what's going to be helpful to you. So we try to get you information from you as a whole. So be prepared when you call us. We're going to try to get some information from you so that we can give you the best knowledge that we have to support you.
Yeah. And I love the fact that you said that there's no insurance. Nobody's going to be asking, what kind of insurance you have. BIA is there for resources, information, and education and advocacy, which is great. And the telephone number that you put in the chat, just in case people are watching this as a recording, it's 508-475-0032, or by email info@biama.org to learn more about any type of help or resources or direction that people can take. Should they have any, questions, or if it's something that's really, if it's for somebody in their life, even for themselves. So we are all at the top of the hour. Justine, thank you so much for being my guest today. We learned so much. One of the participants said, thank you for the useful information. So, we got so much out of your content. And I'm so grateful that there is such an organization as BIA out there for all of us to benefit from. And people, if you can make it to the conference at the end of March, that would be great. You can pick and choose if you're a healthcare provider. I'm sure there's different tracks for that. And if you are somebody yourself who is not a clinician, but want to learn more, if you're a survivor or, for family members, there are different.
Absolutely. And there's, Debbie, too, there's different rates too, just for everyone to know here, while there is a denomination connected, there are survivor and family rates, there are survivor scholarships. So really, we try to make it accessible to everyone. And yes, the content is applicable to everyone. So I hope to see some of you there today, there at the end of March. That'd be wonderful. Thanks for having me today, Debbie. Really great experience.
Thank you so much, Justine. So I hope to see everybody next time. I will have on March 8th, Richard Shipp. He is my counterpart at Brigham and Women's. He is the Injury and Violence Prevention Outreach Officer, and he will talk about caregivers and resources out there, how to take care of yourself as a caregiver. And so I'm looking forward to that conversation with him on March 8th from 10 to 11. So in the meantime, everybody be safe, be well, and have a great rest of the month. Take care. Bye-bye.